Hi there. In today's video, we're going to be talking about how to plan for healthcare costs in retirement. My name is Sarah, and I'm here today with iHealthBrokers. At iHealthBrokers, we are licensed health insurance brokers, and we are licensed nationwide. So if you have any questions whatsoever about your health insurance, please feel free to reach us in the comments, or of course, you can always give us a call at 888-410-0344. There's absolutely no charge for our services, and we are more than happy to help. Now, as always, I ask that you please do make sure to click like. That way we can get this information out there. Liking this video will make it more visible to others who are looking for the same type of information. And of course, we release these videos on a weekly basis, so make sure to hit subscribe. That way you stay up to date. And of course, you can find us not only on YouTube, but you can also find us on Facebook. We've got a group dedicated entirely to Medicare with iHealthBrokers, and you can find us on Twitter, TikTok, and Instagram. Now, in today's video, we're going to be talking about healthcare costs in retirement, and it's going to be broken down into two categories. Basically, we're looking at retirement before turning 65, so that's pre-Medicare, and retirement after 65 when you are eligible for Medicare. So if you retire before you turn 65, you're not yet eligible for Medicare, but you do have a couple of options that you can use to bridge the gap until you are eligible. Your three main options are COBRA, marketplace plans, and private insurance. COBRA will enable you to keep your exact same health insurance that you currently have through your employer. You can keep your COBRA coverage for a period of up to 18 months, and if your spouse or your dependents are covered through your health insurance, they can keep their coverage as well. Now, as a side note, if you're close to Medicare age, if you're close to 65, please do not defer Medicare in favor of COBRA. It's not considered creditable coverage, and therefore you could incur a late penalty. Your spouse and your dependents can actually keep their COBRA coverage even after you've switched over to Medicare. So just something to take into consideration. Now, like I said, COBRA will allow you to keep your exact same coverage, but it certainly comes at a price. You can expect to pay at least double what you are currently paying. If you want to learn a little bit more, number one, you can check out our video dedicated entirely to COBRA, but if you want to learn exactly what your payments might be, contact your HR department to find out what your employer is currently contributing. That way you can better estimate your yearly costs. Then there are marketplace plans. Now, the good news with marketplace plans is that they only look at your income, not your assets or your savings. So if you're retiring early and you're living largely off of your savings and your income is pretty low, if your MAGI is pretty low, you can expect that you may be able to be eligible for one of those premium tax credits. And those premium tax credits can save you thousands of dollars per year on your health insurance. So that's certainly a very good thing. But we do want to look at a couple costs. We want to look at premiums, deductibles, copays and coinsurance, and out-of-pocket maximums. So your premium is, of course, what you'll pay on a monthly basis to keep your insurance active. Right now, under the American Rescue Plan Act, actually more Americans than ever before are eligible for those premium tax credits, with many being able to enroll in a plan that's less than $10 per month. However, that piece of legislation is set to expire this year. It may be extended, but that's something to take into consideration when you're looking at your premiums. Then we also will look at deductibles, copays and coinsurance, and out-of-pocket maximums. So your deductibles and copays and coinsurance may be a little bit higher than what you've had in the past, but you do want to remember that there are plenty of services that are actually offered at no charge even prior to meeting your deductible. These are basic wellness screenings and preventative services and things like vaccinations. So if you're somebody that's relatively healthy and you're only taking advantage of those basic services, then it may be rather cost-effective for you. So let's look at a range. Basically, if you're somebody that is young and healthy and only taking advantage of those basic services, then you may be able to calculate your yearly costs as basically just your monthly premiums. But the other important figure to take into consideration are the out-of-pocket maximums. In 2022, a marketplace plan can't be more than $8,700 per year for an individual and $17,400 per year for a family. Basically, once you hit that number, if you hit that number for covered in-network services, your insurance will take over for the rest of the costs for the rest of the year. So if you're someone with higher needs, you could calculate the higher end of that range or spectrum as your monthly premiums on a yearly basis, plus that out-of-pocket max, and those will be your maximum yearly costs. If you're ineligible for a premium tax credit through the marketplace, then those marketplace plans can be a little bit pricey. If that's the case, you may want to look at private insurance. Specifically, you may want to look at short-term medical plans. Now, these can be much more cost-effective than marketplace plans without those tax credits. A young, healthy person can, generally speaking, get a short-term medical plan for about $100 per month, and they are entirely customizable, so you can have as many or as few benefits as you need, but they are going to impose an out-of-pocket maximum to protect you against major medical expenses. Now, because these plans do vary so widely, it's hard to give you an estimate, but again, look at those premiums, deductibles, copays and coinsurance, and the out-of-pocket max to determine your range. If you're going to go the private insurance route, if you're going to go with a short-term medical plan, please work with a broker, because even if you find a plan that looks like a great deal on paper, if it's not exactly right for your needs, you'll end up paying more money than necessary. If you're retiring after 65, then you're going to want to look at your Medicare options, and there are options to choose from. You can choose Original Medicare alone, Medicare plus a MEDIGAP plan, or you can go the Medicare Advantage route. So Original Medicare is comprised of Medicare Part A, which is your hospital insurance, and Medicare Part B, which is your outpatient insurance. They're going to cover most of your medical needs. However, there are some costs that you need to be aware of. Again, we're talking about premiums, deductibles, copays, and coinsurance. However, with Original Medicare, there is no out-of-pocket maximum, and that can be a bit of a problem, which we're going to circle back to momentarily. So with Medicare Part A, there's actually usually no monthly premium, so let's set that aside for the time being. For Medicare Part B, there is a monthly premium, which is based upon your income. The base premium for Medicare Part B in 2022 is $170.10, but it can go up from there dependent upon your income. So again, something to take into consideration. Then there are deductibles and copays and coinsurance. For Medicare Part A, the deductible is $1,556 in 2022. However, that deductible is applied per benefit period, not yearly, so that can make things a little bit tricky. Basically, your benefit period is sort of like a hospital stay plus 60 days. You have 60 days from the last day you received care, and that concludes your benefit period. So if you need to receive services outside of that benefit period, even if it's still the same calendar year, you're going to have to meet that deductible again. As a reminder, your deductible is the amount that you have to meet out of pocket before your insurance kicks in. Now, after that point, you'll be responsible for some type of coinsurance, which is dependent upon your length of stay and whether you're in a hospital or a skilled nursing facility. So for the first few days, either days 0 to 60 or 0 to 20, there won't be any coinsurance. After that, the coinsurance can be quite hefty, possibly several $100s per day. So this is again why an out-of-pocket maximum is very important, because should you need to have an extended stay, those costs can certainly add up. Now, Part B isn't going to be as extreme. You have a once yearly deductible, which in 2022 is $233, and then your coinsurance is 20% of the Medicare approved amount for outpatient services, which are going to be significantly less expensive than hospital services. Again, though, if you want to mitigate the risk, if you want to impose an out-of-pocket maximum and make sure that you have a better idea of what your yearly spending might be with Medicare, you want to look at a Medicare supplement plan, also known as a MEDIGAP plan. A Medicare supplement plan or MEDIGAP plan will fill in the gaps of Original Medicare. It will help to cover the deductibles, copays and coinsurance, and impose an out-of-pocket maximum. Now, the level of coverage depends upon the plan that you choose, but no matter which route you go, you are going to provide yourself with a safety net. Let's say you decide to go with Plan G, which is currently the most comprehensive coverage available. Plan G will cover everything except for your Medicare Part B deductible, which again is $233. So with Plan G, you could calculate your yearly costs as your Part B monthly premium, your Plan G monthly premium, multiply by 12 for 12 months of the calendar year, and then add that Part B deductible of $233. So even if your plan was about $200 per month and you were paying the Part B monthly premium, when you add in that $233 deductible, you're still only looking at about $4,700 for your yearly costs. And that's it. That's taking everything into consideration that Medicare covers. Now, Original Medicare isn't going to cover dental, vision, hearing, and extra benefits, so factor those into consideration as well. Then there are Medicare Advantage plans. Medicare Advantage plans function much like your employer-sponsored group health insurance. You'll have to take into consideration networks, which is very, very important, but again, we're looking at premiums, deductibles, co-pays, and co-insurance. So it's a little bit trickier to say with Medicare Advantage because they're sort of like the health insurance that you've had in the past. They can be so diverse, but they will very often include additional benefits like prescription, dental, vision, hearing, and other benefits as well. However, you're giving up access to that extremely broad original Medicare network. Almost all doctors and hospitals accept original Medicare, and that is not the case with Medicare Advantage, which can certainly be a major disadvantage. Something to take into consideration is where you live. Medicare Advantage works wonderfully in certain locations, and in other places, it's near impossible. So if you are going to go the Medicare Advantage route, please work with a broker to make sure that, number one, it's a good option for you in your location, and make sure that the network is appropriate for your needs. A benefit of Medicare Advantage is that very often the premiums are much lower than Medicare supplement plans, and they're still going to have some type of out-of-pocket max, so you'll have some protection that you wouldn't have if you went with just original Medicare. If you like this video, please make sure to click like, that way we can get this information out there. Give us a thumbs up, and of course click that subscribe button because we do release these videos on a weekly basis. There are constant changes and updates coming in the world of Medicare and health insurance in general, so we want to make sure that our clients and our viewers are as well informed as possible. And of course, make sure to find us on TikTok, Twitter, Instagram, and Facebook. And if you have any questions, if there's anything you feel like we left out of this video, if there are experiences that you'd like to share, you can let us know in the comments below, or you can always give us a call at iHealthBrokers at 888-410-0344. We are licensed nationwide. We are more than happy to help you with any and all of your health insurance or Medicare related questions. Thank you so much. Have a great day. Bye-bye.